Welcome everyone to UEO's Health and Wealth Summit 2020. This is the emotional wellness during COVID-19 session. My name is Shae Gorham and I will be your moderator this morning, almost afternoon. And right now I would like to introduce our panelist, Miss Andrea Brown. She joins the Black Mental Health Alliance as the new executive director. As a seasoned senior executive, Andrea served in several leadership roles at the National Association for Advancement of Colored People, the NAACP. Those roles include strategic planning, membership development, and training. In her role as Director of Internal Affairs, Andrea provided oversight for affiliate chapters across the country and those on military installations in Germany and Japan. Andrea's passion and expertise in leadership development, nonprofit management, and strategic planning afforded her the opportunity to collaborate with high-profile local and national leaders. Throughout her career, Andrea implemented and provided oversight for a variety of direct service programs and managed federal, state, local, and foundation dollars in excess of $3 million. She developed strategic initiatives and programs for nonprofit and state entities. Serving briefly as an executive on loan for the Baltimore City Detention Center's jail based on substance abuse treatment program, Andrea developed strategic initiatives designed to enhance programming. The program was recognized as a best practice model and replicated in other Maryland facilities and other state penal institutions. Andrea co-authored a leadership training manual for juvenile detainees, which is used in juvenile facilities across the country. She holds certifications in community mediation and executive coaching. As a community activist and advocate, Andrea has volunteered her mediation services to at-risk Black and Brown communities across the country. She has written articles for BET Online, Heart and Soul magazine, and other periodicals. Andrea has an undergraduate degree in political science and a master's degree in legal and ethical services studies. Andrea serves on the Mount Washington Pediatric Foundation Board in Baltimore, Brown Girls Lead in Washington, D.C., and on several other local boards and advisory committees. She is an active member of Delta Sigma Theta Sorority Incorporated. Andrea resides in Baltimore with her husband and teenage son. So, Miss Andrea Brown, we welcome you.
Thank
and
you.
would love to hear what you have to say. We also have a few questions for you.
Wonderful. So first of all, thank you for having me. And happy Saturday. I know everybody is zoomed out all week, right? We Zoom all day, every day, the whole 9 yards. So I promise you we will. I was going to do slides. I'm like, you know what? These are professionals. We're gonna talk through this. I've got some information I do want to share, but again, thank you for having me. I want to salute your president, Kendra Brown, no relation, but for her work. And obviously the committee that has helped put this together. Certainly want to shout out to Miss Kelly, Rosalind Kelly, who has, since, hey, you down there. See, this does make it fun when you do it this way, but really want to, again, thank you for the outreach and for really bringing this, what we know to be important topic. Absolutely, and I don't know how you came up with turning the tide, taking back our health and wealth. I think it is powerful and it speaks to this moment that we find ourselves in. And it is synonymous. They are the same. And oftentimes we assume wealth with money, and that is so, but our health is also our wealth. And not just our physical, but also our mental health. So again, thank you to the first sorority that there was. I appreciate you guys leading the way to us. And I love the notion of sisterhood among the Divine Nine and among us. So thanks again for that. I do want to just start off with this quote, and it is not mine. It's powerful, but it's not mine. And it is by Marianne Williamson. I know we've heard it before, but I just feel like it helps set the tone for where we are headed. And it is, our deepest fear is not that we are inadequate. Our deepest fear really is that we are powerful beyond measure. It is our light, not our darkness, that most frightens us. We ask ourselves, "Oh, who am I to be brilliant, gorgeous, talented, fabulous?" Actually, who are you not to be? You are a child of God. Your playing small does not serve the world. It doesn't serve the sorority. It doesn't serve the community. It doesn't serve. There's nothing enlightened about shrinking so that other people won't feel insecure around you. We are all meant to shine as children do. We were born to make manifest the glory of God that is within us. It's not just in some of us, it's in all of us. And as we let our light shine, we unconsciously give other people permission to do the same. As we are liberated from our own fear, our presence automatically liberates others. And so again, it's not mine, it's Marianne Williamson. And I like to lead with that, especially when we start to talk about health and wellness, because, there are some fears. COVID is new for us. And if we start to think about who we are and how we find our voice in this moment, it can change the game for us. And so I want to stay on script because I can get off script, but I want to stay on script. But I do want to say a couple of things, and that is probably in March, the Black Mental Health Alliance, when COVID first started, I was 8 days into my new job. 8 days. I didn't know my staff. I'm like, who are these people? Now we're working remotely. And so, but it really gave us an opportunity to learn, but it also gave us an opportunity to have a real pulse on what people were feeling. And so we immediately hosted an emergency town hall. I know everybody else did too, but we immediately hosted an emergency town hall. And the title of the town hall, and I'm going to give it because I think it also helps sets the stage for us. And it was the collateral consequences of COVID-19 on the Black community and the collateral impact. When America catches a cold, the Black folk catch pneumonia. That was the title. It said the Black community, but since I'm among family, I just say the Black folk today. And so, and the truth of that is it really gave us an opportunity as we started talking about what the front line was. Now that our children were home from school, all of those kinds of things. How do we begin to realize that our impact looks very different than the impacts on our counterparts? And so, and I know you want to probably ask me some questions, Shae, but I just wanted to set that up because, we have to know that the impact for us is different. Our front line looks different. Our front line looks very different. And many of our front line went out to work when everybody else was able to stay home. And so number of things that we were up against: fear, social isolation, and we can talk about some of those things. Depression, not even recognizing I am now depressed. Intimate partner abuse on the rise, because now not only are you home, the kids are home. So I can't, if I wasn't doing the things that I was normally doing to at least kind of diminish what the intimate partner abuse, now that's on the rise. And so part of what we were finding was this plea from the community saying, there's something going on, and how do we handle this? And we have this notion, because we are resilient as a people and as women and men, we assume we don't need to do a call out. There's no 911 for us, and it really is. And so, again, I wanted to set the stage for that because, oftentimes I've heard people say, I know we need to get over it. Well, this is a different norm. Getting over it looks very different. And so, I'm happy to let's talk about where we are. Let's talk about what does turning the tide look like? And it will look different for everybody. Still, we've dealt with loss in a different kind of way. We couldn't funeralize our families the way we had normally done in the past. And again, this whole notion of community changed for us, because if we followed the guidelines throughout the states, it just changed for us. And so part of what we've seen is even college graduates didn't graduate the way they normally do. And for first generation college students, even that came with something. And so how do we begin to have the conversation with people about it's okay to seek a professional, right? That's part of where our help comes from. That's community. And so oftentimes, you know, we've heard people talk about, I promise I'm gonna keep quiet after this statement and let you ask a question. We've heard people talk about, you know, I'm gonna go see my pastor. Great. But there's another prescription you can get. That is a therapist, and a culturally competent therapist. And part of what we are working on doing is even training the church to say it's wonderful, but it's more than 2 steps. And then I'm back to what I normally feel. I don't even know what I feel like anymore. I am numb. But I think again, this topic and the theme really does set the tone for where we are headed. And turning the tide really is, should we be on the road to recovery? Yes. Let's start, even with the second pandemic, let's start to look at things a little bit differently. I mean, not the second wave. So that was a lot, right?
But it was very informative. Thank you so much. And I totally understand, as a mental health clinician myself, you know, the Black community really do sometimes disvalue therapy and seeking that help. And that kind of segues into our question, especially in something you said stuck out to me. When America catches a cold, the Black community, or the Black folks, we catch pneumonia. So with this question, according to the Center of Disease Control and Prevention, in African American health, African Americans are more likely to report that they cannot seek a doctor because of cost. Young African Americans are living with diseases more common for people of older ages. So the question is, what is the recommendation? How do we encourage African Americans to advocate for their own health? And that, you know, albeit mental health, physical health, how do we encourage our community to advocate for themselves?
I think it's such a great question. I think we do it in 2 ways. So there is, you know, there's almost, since COVID, there really has been a loss of community. I mean, it really has, because at the end of the day, there's no substitute for a hug or a touch. It just isn't. And we do the best we can with what we have, no substitute. And anybody tells us that is being dishonest. So I think one of the things that we have to do, we've got to be intentional about going where our people go. So if you are back in the hair salon, then we need to tell stylists, we need to tell them to start to have the conversation about what resources are available to people so that they do know, making sure even in this moment, keep your telehealth appointments, keep them. And if people often say, well, I don't have insurance, there are places, go to the state, go to your local health department, wherever that is, whether that's in Wacomico County, go to your local health department, because there are resources available, and don't leave until you get them. And so, but again, I think our messaging as a community of women, as a community of Black people, has to look different. How are you taking care of yourself? We had a small meeting a couple of days ago with some members from our team. And I asked the question, I said, what will you do to honor yourself? And, you know, everybody's like, I said, no, this month, we're about to, whoa, my chair, my son bothered the chair again. So now I'm down on the floor, but I'm back. But I kid you not, 16, you would think you got your own stuff. Why do you have to use my things? But so the question came up, what will you do to honor yourself? And so, you know, again, these are all clinicians, and they're like, I'm like, how are we stuck? What will you do to honor yourself? And so somebody spoke up and said, you know what, I'm gonna make an appointment for an eye doctor. So it's those simple things, but I think we have to seize every moment to ask the question. And as we get resources, I love to do a billboard. I love to have resources to do a billboard, especially in the heart of whether that's 21217, maybe on North Avenue, in any of our communities where we find ourselves, to say, have you checked on your health today? When was the last time you had a physical? And so I think, you know, we have been pushing this whole notion about radical self-care. And, you know, but again, people assume because of us, because of the way we do what we do. We take care of everybody and themselves. We often neglect everybody else but ourselves. We often neglect ourselves. But I think we've got to start messaging that. And I think we do it in almost a grassroots way. We do it in our churches. We go, we say, Pastor, if we're going to be on Zoom, we need to ask people, have they had a physical? We've got to do it in a grassroots way, especially in this era of COVID. But for those of us, some who go back to salons now, I think that has to come up. And so it is really about social responsibility for us in a real way. I still go to the barber, and she's a woman, and I asked her, I said, how are you honoring yourself? How are you taking care of yourself? And she said, I think I'm depressed. And I said, well, what makes you think that? And she said, all I want to do is sleep, but I know I need to make money. And I said to her, you know what? She said, I'm afraid to talk to anybody. So again lies this notion of the stigma related to mental health. It's okay to talk to somebody. We do it all the time anyway. And we do. We say we don't, but we do. We talk to our girls, we talk to our friends, we talk to, Big Mama, we talk to all of those folk. But it's okay to find a culturally competent therapist to be able to see that looks like you, understands from your lens what that means. And so I hope I answered that, but I think we've got to push people when they say, I don't have insurance, because here's the other thing. We are underinsured and uninsured. We are underbanked and unbanked. If we're going to talk about wealth and health. But I think those are the conversations. There are resources available. But, and again, I wouldn't leave my health department until somebody told me where I could get a physical if I was underinsured or uninsured.
Thank you. Thank you so much for that. I don't know if you could tell, but I was over here keeping notes.
I couldn't remember.
That was a good point. I like that. I'm going to keep some notes.
Good stuff. Yeah. And if I could just, again, talking to a group of women, I work longer and harder on Zoom. I kid you not. I'm like, this remote working is insane. I'd rather be in my office. And I traveled a lot when I worked with the NAACP. Loved it, but traveled. And one of the things that, just really wanted to stop traveling so much, racism doesn't sleep, just like all of this where we find ourselves. And so at any moment I could be called to any place, Ferguson, whatever, so that we can organize people. But, we've got to ask ourselves, how do we take care of ourselves? And what does that look like? And it's the small things. And it is about honoring ourselves. And, I'll be the first person to say, even myself, after she said she was going to make an eye doctor's appointment, I was like, okay, why not shame me into going to see my GYN? You know what I mean? So, but my point is, those are the kinds of questions we have to ask ourselves. And we really have to get radical about our self-care. We do. Our self-care all around.
Thank you. Thank you so much. I do want to encourage some participation from people, from the attendees. So Ebony, there's a question in the chat.
Yep. So one of our actually chapter members asked, Ms. Brown, you mentioned people feeling numb with all that is taking place. What are some recommendations for emotional self-checks so that numb doesn't become the norm?
Wow, that's so good. Numb doesn't become the norm.
I like that.
I think, I love that. As a matter of fact, let me write that down. But the truth of the matter is, so I'm so glad they raised that so that numb doesn't become the norm. So I think there are a couple of things. So, there's this four R's, routine, rest, resources, and reach out. And so, again, we've got to continue this sense of community. That's how we thrive as Black people, as Black women, as a community. We've got to develop some new routines. Some new routines. I think I shared earlier, this whole notion of, you get to work remotely. I'm like, do you know I'm on Zoom at 12 o'clock or 11 o'clock? I'm writing a paper or writing a memo or preparing for something. And so I think, redefine what you once did, okay? And so do new routines. You gotta work out. You gotta figure out what workout looks like to you, whether that's prayer and meditation, And again, you got to be intentional about check-in. So routine, make sure you have a routine. And if you need to change it up so that you don't become numb, that's how you do that. And you gotta rest. And let me just tell you, I threw rest in because I am talking to myself today. I don't rest enough. My nights are long. We did a podcast last night, and it wasn't enough that the podcast was over at 8:30. So we had a collective meeting after that. Then I came home and prepared for something else till 12 o'clock. And at the end of the day, we've got to ask ourselves, set boundaries and barriers. And so but again, that's gonna be part of it. And talk to somebody, and even if it's not a licensed clinician, make sure you get to have a conversation. Stay engaged. And I know this is the era of text. Let somebody hear your voice. Do a new thing. And let the arts nurture you. Now, I'm not talking about going to the theater, because I don't believe that that's an option for us now. But what is that we have all kinds of music at our fingertips, because then you get to come in and who am I? What am I doing? And I think, this is obviously not one of the routine rest resources and reach out, but journaling is healing, because again, you get to do two things. You write about what the moment that you're in, but then you write about what's possible. I think Shae mentioned that I do some executive coaching, and I have a book that I use called Style Your Mind. And I get to create, not necessarily for my clients, but even for myself. I'm like, you know what? This is a blank canvas. What will I do with it? What will I do with the blank canvas? So I think, again, allows us to talk about what's happening, but it also gives us an opportunity to sort of paint our world. Where do we go from here?
Sorry, I was muted. Okay.
Okay, you look like, look, in full transparency, when I first got on Zoom, I had my mask on. I'm like, and I hope you guys didn't see that. I'm like, we are so programmed. I'm like, oh, I need my mask. It's a true story. Pulled it out. I was like, oh, I need my, and I'm like, and then I put it on. I'm like, girl, if anybody saw that, you're gonna lose your job. But no, so I get it. It's between the mute, unmute, and my own video. Is my hair okay? I got it. So it's all good.
We're getting used to it. All right. So this question, I think it's another good question. What are some things we can do to help our seniors with social isolation during this pandemic time? A lot of them aren't using Zoom and other social medias, and may be even less connected than we are.
So, we've been, we struggle with that, but I think that there are some wonderful things that we can do. And number one is, I think we set up a schedule to make sure we call. So we do almost like a neighborhood watch. They do have phones. They still have landlines. My mother, who is 79, has a landline, girl. You better call her on her landline. And so we call every, whether it's every day, but establish a schedule to call. But here's the other thing. This is my new favorite thing. Do a drive-by with a note and say, what 5 groceries do you need? And then let them check them off and say, I'm going to bring them back and I'm going to sit them here. So we are the most creative people on the planet, but do drive-bys. I think I shared earlier about, and I want to be mindful about not this too much testimonial, but I have a 16-year-old son, and he turned 16 like at the end of March, right near the pandemic. Everything had shut down, and he has begged us for a do-over, begged us. But we didn't think then to have friends come through the neighborhood. We didn't, now we have that. People are understanding to do that. But and here's the other thing, ask them, send a note. And when I say send a note, drive by, put a note up and say, how about, do you need me to fill out your absentee ballot? Do you need me? So there are some creative things that we can do. I think, again, we commit, how can we get you groceries? Maybe it's a group of us, but I think those are the kinds of things that we have to do, because and when I say we caught pneumonia on this, we did. So remember, our seniors, many of them who are older and unable to get out or just don't get out as much, because they have compromised immune systems, they see less and less of us, when normally that's where we were on Sundays. And so again, there's this whole notion of the community as they knew it, as we knew it, looks totally different. And so it is important for us to utilize every opportunity to do a drive-by, call, do you need anything? Who's picking up your prescriptions? There's enough of us in the community to be able to do that. But those are the kinds of things. But I can't urge us enough, especially, 28, 38, whatever days we have left in regard to the election, make sure they have what they need. Find out if they have a ride, and find out so they won't get bamboozled. And we can see them we can see them through the door. I've seen people hold their hands up. That's the closest thing they can get to touch, but it is something. And so I think those are some of the ways that we do. And then again, we've got to call, we've got to check in on a regular. And those are easy things that we can do, that we can definitely do.
Thank you. I appreciate that. It's our responsibility to check in on our seniors.
Yeah.
Ebony and Claire, was there another question in chat?
Yes, so there's a question from Miss Brianna Williams. Working from home is definitely an adjustment. What can we do to stay motivated and productive?
So let me just tell you, that is a daily, again, routines, and sometimes we got to change those up. So some of the newer things that we are finding, and here, I can't say this enough, working from home, this is, I traveled a lot for my last job, and then went from an office to home. I'm like, well, who are these people? Why are you here in my space? But, I think that again, change up your routine, do some radical self-care. So that if that means you take an early morning walk, if that means, switch out your day a little, and if you have the flexibility to do that. And so again, get up, make sure you have a routine, because to not have one can be detrimental. But to have one and even have to change it is a bonus. So change up your routine. Make sure you are getting rest, water, and exercise. You gotta exercise. And so there are a number of group things that are, as a matter of fact, there was something that just came out, and it's called a Black Girl Boot Camp. And it is, again, you do 30 minutes of walking, whether it's in the afternoon, so you got to change your routine up some, and stay away from the kitchen. That is, honestly, I see DJ had that look. You saw her, she had that look. Stay away from the kitchen. That's not your office. That is not your office, and it's a setup to set us back. I'm telling you, stay away from the kitchen. So what I do, whatever I was doing when I left, when I come back in, take my shower after my workout, I come back in, and I don't even go near the kitchen. I don't, because I wouldn't be at the kitchen if I was, honestly. And I'm gonna tell you something else. Sounds a little nutty, but it doesn't hurt. For a minute, I was packing my lunch. So I would little lunch. I'd have my food or whatever I was eating, whatever you eat, but stay away from the kitchen. I know it's hard, DJ, but you gotta stay away. You gotta stay away. But if I could get us to get to a place where we get to this every day, we say, what does radical self-care look for to us? Audre Lorde, who is long gone, a poet, activist, one of the things that she talked about is about self-care. And the notion that I'm gonna take care of myself first is radical. And we gotta do that. It is radical. And she also said our silence won't protect us. And so and I want us, and at some point, when maybe we'll do that now, I want us to have a conversation about that is mental health. When you find your voice, you are giving yourself permission to begin healing to begin turning the tide. And so, our silence won't protect us. And so we've got to be able to talk about how we feel. We've got to be able to talk. I promise you, I hear people say, I'll never go back to the office again. I can't wait to get back to the office. And it's not so much, it is just this is, my hours are longer. I'm I'm working on balance. I make sure I work out now. I think one of the ways to help me set boundaries is committing to a 30-minute walk in the morning and or run, and something in the afternoon, evening for 30 minutes. Then I get to shift. So I get to define what I want that to look like and to begin to heal myself. And so again, radical self-care, there's, oftentimes that's difficult for us to hold on to because we are so used to taking care of everybody else, but we can't give from an empty cup.
I believe we have another question for you, Andrea.
Okay.
Yes, and so this question is from a fellow clinician. And she says, I'm finding that the patients that I serve are more parentified since this pandemic started. What resources can be provided to parents in addition to their own therapists that can help take the pressure off of them so they can be emotionally well for their children?
Wow. So, I think a couple of things. There is, that's so good. So good. So I think we have a clinician. She doesn't work, she's not on our staff, but she consults with us. And one of the things that she talks about often is about plan. Yes, girl track. Yes, I'm sorry. I just got sidetracked. I'm really good at what I do, but I saw girl track. That's exactly what it is. We'll go back to that. And she talks about the importance of play for children. And, oftentimes our children don't play enough. And we've got to go back to those, again, encourage them to play. Maybe you don't have a backyard, maybe they don't have a backyard, but there are other things that they can do. And so so I'm hoping that settles it. But we've been struggling with that, and we've been talking about how do we, especially in this era where our children are either home, maybe they're in a hybrid model for school. But I think that look on our website. There are some additional resources at theblackmentalhealth.com about parenting, and again, setting boundaries for ourselves as parents to help our children. So, okay, go ahead, Shae. You got another question? Your lips are moving, but you're on mute, I think.
Sorry again.
No, it's all good.
I was just going to ask Ebony and Claire if there were any additional questions from the participants.
Claire, did you have anything? I see one regarding boundaries. And so what are some ways, I know you talked about boundaries as self-care, right? And so what are some ways that you would suggest addressing boundaries with, I'm guessing this is probably in the context with others, our family, who may not understand the need for boundaries, and ways to help them understand how important it is.
Oh my gosh. So I think we have to start educating them. And we say no is not a dirty word. No isn't a curse word. No is healing. And I think we start to lead with that empty cup theory. And I can't give you from a cup that is empty. And I find it difficult to fill it when all you do is ask and pull and pull. So I think there are a couple of things. Set aside times. This is your time for us. This is family time. This is, whether that's a spouse, because, well, I'll defer. I've often said to my husband, you do know that I am working, or you do know that I am writing. You do see me with a pen in my hand. But I think, again, I've said, you got to set specific times sometimes. I love, one of the things that COVID has done, and I can appreciate, is that we find ourselves doing different things. So my husband bought us all bikes, right? I say us all, but it's him, my son, and myself, bought us all bikes. But what it has done is I get to ride the bike with my teenager. My husband bought the bike back in March and hasn't been on it once. It's cool. But what it has helped us do, my son and I, is to bond. And so, but now I say, you know what? I'm going to take my bike out for an hour. Don't call me. Don't call me. I got idea. If I get hit, they'll find me. Don't call me. There's nothing on my bike I can do for you? But I mean, but you gotta be, again, remember, no isn't a dirty word. It's not. It is no, not right now. It is today. And so again, you gotta set boundaries, but you've gotta know what it is you need. And so identifying your own needs. And I don't need it all the time, but there are times when I just want to read. I'm a voracious reader. And when I am reading, you come close to me, I might cut you. And so I'm saying, I promise I'm not going to cut him. I see Henry looking at me like, if you cut somebody, I'm going to report you. But I say these are the times when I'm doing these things. And so again, tell them no isn't it, but people aren't used to it because we don't say it enough. And if we are talking about how we turn the tide, how we take back our health and our wealth, and again, your wealth is tied into your mental and physical health. It is. If I am well here and the rest of me, then I'm in a much better place to be able to give to you. I'm operating at my optimum. So.
Wonderful. Wonderful. Any other questions, Ebony or Clara?
Nope, not at this time.
Okay. And participants, feel free to add any additional questions. Andrea, do you have any closing remarks or anything you want to leave us with?
So a couple of things. I want to be able to say, we talked a little bit before about, the notion of family time. So the one thing, again, COVID has opened the door for us to do some creative things. Obviously, I'm bad at checkers now. I will beat you at checkers. And so board games, that is a sense of community for our families. Cards, I'm not good at cards, but you come with me for checkers, I'm gonna come for you. And those kinds of things. And so we've learned how to play a Scrabble. So board games, things that are again that we used to do that we don't, because we got the phone, we got this. And then loving the great outdoors. There's something about being connected. And I know, sometimes people are like, I don't like outdoors, it's too hot, it's too whatever. Well, today it's not too hot. Today it is nice. But the opportunity to connect with nature, that's not the norm. That's not like 3 steps and I'm straight. But the truth of the matter, those are things that are important. There's, again, no substitute for a hug. I wouldn't say that. But what I will say is that it's an opportunity for us to bond in a different way, and at least in our close knit. So I want to talk about the last thing I will close with is, and I think I said, one of the things that Fannie Lou Hamer left here in her 50s. And she said, I'm sick and tired of being sick and tired. And part of that was, there's a heightened level, at least for me, of anxiety about this upcoming election. And I think we need to talk to people now, not about the vote, but about how they feel. Ask them in a real way, because there's pre-anxiety and post. Because no matter what happens, there's going to be anxiety, right? No matter who, there's going to be anxiety. And so have the conversation, but cut the news off, because that you got to find some quiet space and cut the noise. Shut out some of the noise. And so I want to be able to say that those kinds of things are important. And then don't apologize for your decision to elevate your thoughts and upgrade your life. Don't apologize for those. And go ahead, write that down. I know you want to, Shae. That was pretty good, right? That was good. Don't apologize for your decision to elevate your thought and upgrade your life. And an upgrade is sometimes upgrade isn't stuff. Upgrade isn't stuff. It is now I'm thinking at a different level. I'm thinking and doing I'm taking care of me. It is about radical self-care, honestly. And we do the same things. Oftentimes I hear people talk about, we lost, what's that little fine dude that just died, the actor, the Black Panther?
Chadwick. Mm-hmm.
Yes, Chadwick. But anyway, yes, fine. But, we talk about, so again, push our families to make sure that they get tested for everything. That needs to be on a t-shirt. Okay, Robin, you make it then, girl. I'll buy one. And so those are my closing. I think that would be my closing comment. And we really can't afford in this moment to be silent about anything. And so, while I encourage us to block out the noise, we do that. We do it in a smart way. We cut CNN off. We do all of those things, but we cannot be silent, because this is the moment that we find our voice and our truth. And so thank you again for having me. Just know that I am hyped about Kamala Harris. I know you guys own her, but she's a part of the Divine Nine, so do we. So I just, I'm excited about what will come for us again, because whatever happens, this is our moment. So thank you, ladies.
And thank you so much. I believe we're going to have some thank yous and some closing remarks.
Yes, we are just waiting for Ms. Brown. Are you in?
Yes. Okay, so let me just tell you, you guys sent me something, but we didn't get to pick it up.
Oh.
We tried to pick it up, so we don't have it, but I promise I'll send a picture as soon as we get it. We went to the post office and we were like, can somebody I need this. And so they said, well, you got to come back early. And so my apology for that.
No problem. It was we wanted to present you with something similar to this.
Beautiful.
Your name on it, as well as the certificate.
Yes, thank you.
So on behalf of Upsilon Epsilon Omega chapter, and our president will be joining momentarily, I just want to thank you, Mrs. Brown, for this terrific discussion. This is such a timely and informative dialogue, and it's ongoing, and it doesn't stop here. So we really appreciate you investing your time. I'm the Vice President and Program Committee Chairman of this event. And when we heard that you were able to speak today, we were just so excited and delighted. So thank you to our moderator, Ms. Gorham, for moderating a great discussion, and for our participants for really having an engaging discussion. I did want to just share a few things coming up with those in the room. With our focus, we're continuing our focus on health and wealth in the next week. So on Monday, we're actually going to have Dr. Lisa Newman, who is a breast surgical oncologist, who is going to be speaking on breast cancer awareness, detection, treatment, and prevention. So the information is there. It's also on our website. Join us on Monday at 7:30 p.m. And then Thursday, we kick off our Dave Ramsey Financial Peace University virtually. And thanks to one of our panelists early this morning, Mr. Hart, we're actually able to sponsor not one family, but 3 families for free for this course, for this 9-week financial wellness course. So there's more information on our website on how you can sign up and be entered into be able to, if you know a family, if you want, you yourself are considering to be sponsored, let us know, but the information is there. So we just wanted to share those things coming up in our immediate future. And again, thank you, Ms. Brown, for this discussion, our moderators, and our attendees. Madam President?
Hello, thank you so much for sharing with us today. We sincerely appreciate you for the information and for taking the time out to join us this morning. I know that your session, I see, has 32 participants in it. So I know
Hey, we rocking this session.
Yes, and that is because health and wellness is such an important topic, and understanding the dual pandemics that are happening at this time and knowing how to navigate that, right? We all need to really work to understand that it is a process. It is still something that we are all striving to really navigate. So thank you for taking time out this morning to share and join in with us. We sincerely appreciate it.
Absolutely. Thank you so much. It's exciting. Again, the topic is for the moment. And so I can't wait to see, what will happen as a result of this. So thank you again for the invite.
Thank you.
And thank all of the participants. Thank you, Andrea. This was wonderful. I have a lot of notes. I
Good.
have
Well, you know where to
a
find
lot.
me.
I'm really
Yeah.
excited to really start thinking and utilizing some of the things that we've discussed today with myself, with my family, my children, my clients. So I really appreciate this. There's a link in our chat. We ask that you fill out the survey, all of the participants. I believe it's at the top. Is it at the top of the chat, Ebony? I think I believe it was at the top, or it's added right here. So it's right there. It's a Survey Monkey. Please, please, please fill out that survey. We greatly appreciate it. Again, thank you so much, Andrea, and everyone. Please check out our future events to come.